On this episode of the Ask Mike Reinold Show, we talk about some of the strategies we use to get athletes to buy into our treatment plan.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are socially distancing from our homes, and Mike Scaduto is still a champion PT in performance. So
people actually moved in, and I sleep here now. So
it's the cleanest place on earth right now. People are probably going to ask us in the comments. We probably should have addressed this on an earlier one, but we are, obviously during the COVID coronavirus situation here, we are socially distancing. And in Massachusetts, we're not allowed, obviously, to leave our houses for non-essential things. So we are all treating a little bit, here and there for some of our very small amount of essential peoples like post-ops and stuff like that. But we're certainly trying to do our part, on socially distancing just to make sure we knock this thing out. But I'm here studentless again because the students have evacuated the state back to their middle of the country states where there's less virus potentially. But I am here with, all the way at the bottom, Lenny Macrina. What's up? Things are consistent here. I like it. Mike Scaduto down here. What's up, Mike? Lisa Russell and Dan Pope, fitnesspainfree.com. Everybody is here. We are here answering your amazing questions. So, Mike, what do we have for a question today? Oh, well, here's our question today. Let me see. I have my own question to answer. So, let's see. All right. Corey from California, from Chapman University, actually, which I got together with recently. Corey had a question I thought was pretty cool. He said, when working with athletes who are very high level and potentially have a lot riding on the therapy you're giving them and have expectation that they'll get back on the field ASAP, how do you get them to buy into your treatment and plan of care that you've outlined for them, especially if maybe it doesn't fit with their own timeline? What are some strategies you like to implement? This is a good one. I like the way you phrased it too. So we got high-level athletes. They want to get back as fast as they can. A, how do you get them to buy into your plan? But B, how do you do that if it doesn't fit their plan? I think it's a good way of rephrasing it right here. Who wants to start this lovely question?
I feel like this is every day.
So many ways to go with this.
Yeah, I think that's a pretty loaded question. I think you guys should probably. I think first off, you should have an honest conversation about the timeline that the athlete wants, and why are the two timelines not really lining up? Is it a post-op patient who has unrealistic expectations coming back from surgery, and they think they had Tommy John 3 weeks ago, and they want to start throwing at month 2 and be back on the field at month 6? Like, I think that comes down to setting expectations for the patient, and I think that's that conversation you have to have early on, hopefully even before surgery, before they undergo surgery, if it's something like that. But if it's another circumstance, I think you have to remind the athlete that you're working for them, and maybe you have to make compromises in the plan to try and work towards their best benefit without putting them at risk for re-injury or anything like that.
Nice. So two things I liked from that, Mike. One is probably trying to set some clear expectations at the beginning of all this, so establish that early. And that's something we usually do with our athletes on their first visit or so. And we kind of say like, all right, okay, so you strained your hamstring. All right, well, what's going on? We're in season now, right? You got anything coming up? You're a freshman. You're not even playing on the team. All right, let's put together all the factors together. Like, oh, this is senior year and you sprained your ankle and your last football game is this week. Right? You got to put those factors together. So kind of getting together and having those clear expectations. I like what you said there, Mike, a little bit about like maybe we got to, I don't know if meet in the middle is the right term because that's not always the right answer, but I think I would say that nothing's completely black and white. unless it's post-op and you have some clear healing guidelines, nothing's black and white, right? I see a lot of like young clinicians and students get caught up on this where they're like, oh no, nope, you have to take 2 weeks off from running because I read that in a book. It has to be 2 weeks, right? I mean, nothing's black and white. People here heal at different rates. We're always trying to like play with that spectrum of go as fast as we can, but not too fast to kind of help them. So there is no definitive answer. So I got that kind of thought while you were speaking, Mike, but I think, that's one of the things if you're a therapist and you're developing your treatment plan and you got this hardcore thing in your head that the way it should go, maybe it's partly you that's at fault. Maybe you need to be a little bit more like, let's play on the fly. But what else? What other strategies or tips that people have? What's up, Dan?
Kind of going backwards, but I think this is, there's a variety of things you can do. So first and foremost, and she may be beyond this point, but I think that you need to kind of win people over before they even come through the door. What I mean by that is that if you're in a specific population, so I work with ton with fitness, right? So a lot of times people are coming in to me because the coaches recommended, right? Or they read about me online, or they see the background that I've had, and then the rapport is going to be that much better just because they trust you, right? And I think that's very, very important. What I was going to try to add to the conversation was I think the listening is going to be extremely important because at the end of the day, we're not here to get our own agenda accomplished. We're there to help the person that's in front of us, right? So you really have to listen to that person, see what their needs are and what their desires are. And from that point, we can start to develop a plan of care and maybe say like, look, if you want to get back at this point, your risk of injury is potentially here, right? But if you follow my plan, it's a bit better, So you're not necessarily contradicting people. You're just giving them the pros and the cons, and they're trying to make a decision together, So
I like that. I think you phrased that really well, Dan, too. And I think that feeds into a lot what I said, too. There is no black and white. Everything has a risk-reward ratio, and you just got to put that together. And I think you said that really well. So, Len, was that you?
I think a lot of it comes, you have the conversation, and you're like, oh, let's look at you now. Let's see how you move. Let's see how you present. I like your thoughts. I think we can do a lot of that, but let's just see how you move. And then you start doing the assessment or the evaluation, and you start seeing objective stuff, or even, they start reporting some stuff, and you're like, well, for me, I do a lot of muscle testing with the handheld dynamometer. If I see a big, a loss of strength, but particularly in a baseball player who's coming back from Tommy John, because I get a bunch right now that are, they're ready to throw. They think they're ready to throw. And it's 4 months out, and the doc cleared them to throw, and then I start doing some of my assessments of them. They're presenting with a pretty good cuff weakness. I don't think it's time to throw, and then I have to figure out, all right, let's maybe wait a month. This is why I think we can wait a month. You see the numbers here. You feel the difference when I resist you. Let's buy more time, because let's calculate if we add an extra month of strengthening and don't throw, how does that affect the back end? You know what I mean? How does that affect your time to come back? Well, it really won't, because I'll be ready now in February versus January. So it won't really affect me for my spring season. Perfect. I think we found some stuff that we can work on, and I think it's still not going to affect your season. So I think a lot of the times that stuff falls into place perfectly. And believe it or not, you end up finding a happy medium, and you can justify it by some of your assessment stuff that you do. But I think getting the person to buy in, like Dan said, and really get a good conversation going, and you're listening and you're open to it, and you have to justify it with something objective if you're going to really significantly change their program. I think it oftentimes comes out in some of our testing that we do. So that's how I can oftentimes get around that.
I think that's great. And I think then what you would do there, and I think we may all do this, but I think this is a huge component to it, is that you then have a criteria-based approach. And you go backwards and you say like, all right, look, you want to get back into football, after a hamstring strain. Okay, well, here's what we need to do first. You need to be able to, let's go backwards. So to play football, you need to be able to like sprint, cut, and like run and jump. Right, great. Like you're limping right now, right? Just walking, right? So we got to get to there. Great. All right. So what's our criteria to sprint then? Let's kind of get to that. Like, all right, well, we need to be able to jog with, like a 1 out of 10 pain or something like that. Great. Okay. What's our criteria to start jogging? Well, all right, you need good range of motion without pain. You need decent strength, that type of thing. So here's where you are. Here's our criteria to kind of go through these phases, right? And if you do it with a phase-based approach like that, then I think what you can do too is you can say like, look, in my experience, this takes 4 to 6 weeks, but I don't know. I mean, maybe you're a good healer, right? Like whenever anybody says that, right, that's always, scary. Or no, that's more pain, right? I have a really high pain tolerance, right? Those are always the worst, right? Like, but sometimes people, heal at a faster rate. So look, this usually takes 4 to 6 weeks, but we're going to go by the criteria. And here's your objective measurements that Lenny just took, and I found some issues. Once these go up to here, then we can start this, and then once we do that, we can do that, right? Does that kind of make sense? So I think that's pretty neat. Lisa, I want to hear from you, and I've got an interesting thing for you too. As a pretty high level athlete yourself, right? Like collegiate and stuff like that in the past, like you've done a lot of cool things. Maybe you kind of hear it from your perspective as the athlete that then turned into the physical therapist. But I wanted to hear your thoughts in general.
Yes, I mean I've been there. It's kind of how I met Lenny. I mean, and rowers generally are this athlete, right? They're generally people come to me when they're like on the brink of breaking, like they come to me because their back is hurting and their hip is hurting and their knee is hurting and they're scared about their ribs starting to hurt. And they have to go down to Princeton to race in like a selection regatta to try and make the national team in 2 weeks. And it's like, okay, how do I do this? And the challenging thing is, typically they're not the only athlete involved in the decision of like training plans and everything. Typically people are in a boat with somebody else. So it kind of adds just another layer that you can't just say like, okay, you need to take a break for X amount of time, because then their partner also can't do the work they need to be doing like in that way. So, telling a rower to just stop doesn't happen. Like, it's kind of. I
feel like Dave would say that with gymnastics too, right? It's not always about stopping. It's about, okay, well, what other things can we work on?
Yeah. So, I've had the most success with kind of what Dan was talking about. Just talking to the athlete and figuring out like, okay, what's their expectation? What they want to get back for? And then I usually kind of, show them how they're moving and point out to them like, hey, you can't do XYZ right now. And that causes pain. And, like we need to get these things at least a little bit more under control before you can like really be able to accomplish what you want to. It's, I think, one of the hardest things to do as an athlete when you're looking for that, in rowing, like race day, like you've trained for years to get to this point, and, so I find that it's best to have the conversation depending on how much time you have, right? Of like amending their workload and, displacing some of the, particular like pain causing stresses into other things, and just giving them ways to still feel in control and to still feel like they're making progress. Whether it's like, you got to spend every night doing, this foam rolling or this mobility drill or, different things to sort of like improve their body feel and decrease their pain, while you're trying to figure out what to do with their workload and training plan. But I definitely, like, while Dan was talking, I was like, yep, that's 100% the conversation I always have is like, where are you at? What are you trying to accomplish? Let me tell you the things that you're putting yourself in danger for. And like this ultimately is, the athlete's decision. To go and try and race and do what they need to do, knowing that they're at risk for injuring themselves, but to the point where they're going to really be out of it. I always like to give them that power and give them that information to like really understand their body and understand the risks and to give them some tools to try and kind of fix it, Band-Aid it, or, if you have some time, actually fix it. But
yeah, and at the end of the day, I think you just said it there at the end a little bit here. We work for them, right? We're here to help them achieve their goals. And if they're like, no, look, I'll take the chances. I know I only have a 20% chance of getting back pain free, but I got to play this weekend. Then all right. Make sure everybody's on board, the parent, the coach, the athlete, all those things, and you do your best. And if you're adamant they can't play because you think they have a 0% chance, then it's your ethical right to bring that up. But otherwise, it's let them help make the decision. But we're educators; we need to help educate them a little bit with that. So that's good. I think Lisa brought up some good perspectives too from like the athlete athlete, they're like, you know, letting their team down a little bit, right? And you know, we talked a little bit about this, the mental aspect of injuries, a bunch of episodes ago on the podcast. But like, yeah, there's probably some other things going on too. Maybe this timeline doesn't fit because they have this pressure from the outside. So maybe like trying to help them deal with that in those concepts too, or maybe still finding ways that they can make themselves better, right? Like, so, you know, like Scuduto's low back hurts when he's golfing. Well, I mean, you know, it's a little different, right? He's just trying to break 90 every weekend, where somebody training for the Olympics, like, I mean, man, if this is it, like, if you get injured the week before the Olympics, you're screwed, right? So like,
luckily you got a whole another year this time.
Yeah, well, this year we have 5 years, but you know what I mean? It's like, it's a lot different. So like Mike can just stay at home and putt and chip in his basement, but like, you know what I mean? Like somebody else that's been preparing for a long time is we got to be careful. So just be careful we're not on this high horse, I think, as physical therapists, that they can or they can't do certain things, right? I think there's a bit of a spectrum we should consider. So awesome. Great question. Thanks so much for submitting. If you have more questions like that, head to MikeRyland.com, click on that podcast link, and we'll keep doing it either at home or at Champion. If it's snowing or raining, what's the post office thing? By
rain, sleet, snow, fire, and ice. Something like that.
Is that Fire and Ice? I think that's Game of Thrones. You just threw in Game of Thrones somehow.
By land, by sea, or by air.
No mailman.
That's FedEx, isn't it?
No mailman is delivering you mail if your house is on fire, Mike. They can come back tomorrow when the flames are up. Awesome. But hey, thank you so much, and we will see you on the next episode. Let's social distance, elbow bump.
Boom. Wipe it off now.
Boom. Yeah. And then Purell it and go wash your hands.